Well, good morning and thanks for joining News 6 and clickorlando.com. I'm Lewis Bolden. Today we're going to talk about something you have probably seen in the headlines, or you might have even noticed it in the grocery store, and that is the price of eggs have increased pretty dramatically. Eggs have gone up about 38% in the last year, and experts say that's in part because of what people call bird flu. We've been hearing more and more about the bird flu in the past year, and there have been some pretty significant developments this week alone. So, to get more information about what's going on, we brought in Dr. Benjamin Anderson. He is an assistant professor in the Department of Environmental and Global Health with the University of Florida. And Dr. Anderson, thank you so much for joining us.
Thank you, Lewis.
Can you tell us a little bit about your background and the research that you've done?
Yeah, absolutely. So I'm known as what's called an epidemiologist, and epidemiologists are individuals that track disease. And we do that because we want to understand what causes those diseases. Where my career has focused primarily on is looking at infectious diseases that happen where animals and humans have contact. And when that happens for some diseases, those can be transmitted from animals to humans or humans to animals. And so we spend a lot of time working in those environments. Those could be places like agricultural production, livestock. We have poultry, pigs, cattle, but other kinds of environments as well, including domestic pets, our dogs and cats. We have close contact with them. And so we do a lot of work in that space to understand what the risks of those types of diseases might be, and ultimately, how can we mitigate that risk to stop them from happening.
When it comes to the bird flu, there have been two pretty big developments. Number one, the CDC confirmed the first severe illness related to the bird flu in a person in Louisiana. And the state of California has declared a state of emergency because the virus has hit the state's dairy cattle. We're going to talk about those in a minute. But first, Dr. Anderson, can you walk us through what's been happening across the country?
Yeah, so most people have probably heard the term for the virus that we're going to be talking about as bird flu. And bird flu is caused by an influenza virus. This influenza virus is a type of influenza that is primarily from birds. So this is a little bit different than what we hear about with our seasonal influenza, which happens every year where we have seasonal influenza outbreaks. What's concerning about this particular influenza virus is that we have a lot of history with influenza viruses that come from animals causing large outbreaks. And the most recent one that many people may remember is 2009. So that was called the 2009 influenza pandemic. So for right now, we're really concerned about this particular virus, H5N1, because we're starting to see it show up in a lot more animal reservoirs than it previously was about 2 to 3 years ago. And so this year in particular in the United States, we've had a really big change in how that virus has been circulating. It now is showing up in dairy cattle, in milk. We're starting to see it proliferate a little bit more in some other wild animals, primarily mammalian species. And this is concerning because the more the virus circulates in animals like mammals, that gets it closer to potentially being able to circulate in people. And if it starts to be able to do that, then that's when we get into situations like what we had in 2009 with the last influenza pandemic.
You mentioned 2009. How long has the bird flu actually been around?
This virus has been known about since 1997, around that area. So we've known about this virus for over 20 years. We've been tracking it for a long time in the epidemiological community. It's been on the radar, so to speak. But about 2 to 3 years ago, we saw a change in the virus. Primarily, what we look at is what makes the virus work, which is based off of its genetic sequence. And so a couple years ago, we saw a change in that. And along with that change in its genetic sequence, we started to see a change in the way that it caused disease, and primarily what animals it was impacting. And so even though we've been following this virus for some time, our awareness and our alert has been a little bit higher over the last 2 to 3 years as we started to see a different pattern of infection from the virus. And that leads us to this year where we've seen a major change in how it's shown up in the United States. So we're very much aware that it's a potential risk for continuing to change. And we want to follow that very closely so that we can be prepared in case we see it shifting even closer to potential human impact.
Now, when it comes to the most recent severe case in Louisiana, we know the person is 65 years old. We know they have some pre-existing medical conditions. Do you think those pre-existing conditions, even though we don't know what they are, could they contribute to making this case so severe?
Well, we absolutely know that pre-existing conditions in age are often related to the severity of respiratory infections. Most people are well aware of this issue during COVID. So, people who have pre-existing conditions or who might be older are going to be at a greater risk for potentially having severe outcomes from that infection. So, influenza viruses are very similar. Now, whether or not that's absolutely why the case is more severe, that there requires a little bit more clinical investigation, but it's highly likely that that's contributing to it.
We know the person in Louisiana came in contact with sick birds in a backyard flock. How is that different from the other infections people have reported this year?
Yeah, it's important to note that when we talk about H5N1 bird flu, there actually are some different variations of the virus that are circulating in the United States. The analogy I like to use is think about ice cream. There's different flavors of ice cream. There's probably different preference for those different flavors, but at the end of the day, it's all still ice cream. For this virus, there's actually two distinct genotypes. So that's the word that we use to basically say the flavor of the virus, to put it more simply. And we have one genotype or one flavor that's circulating in dairy cattle right now that has been the cause of most of the reported or confirmed human infections that have taken place this year. Thankfully, among that group that have gotten that dairy cattle strain, most of those cases, basically cases have been mild infections, have not resulted in severe infections. The second flavor or genotype of the virus is one that actually circulates more from the migratory birds that are the original reservoir of the virus and what actually has brought that virus into the country in the very beginning. And that's the virus strain that we also see affecting poultry, so chicken farms, turkeys, etc. In the case of Louisiana, we now know that that genotype, the one that is more from the birds, is the one that is responsible for that infection, which is, again, different than what we've seen with the dairy cattle exposures that have happened in people this year.
The CDC says the threat to the general public is relatively low. Could that change?
Yeah, and this is a really important distinction. The risk levels are really important to understand. I agree and concur that yes, the risk is low. The CDC is correct on that, and it's based off of looking at the current epidemiological situation. However, as epidemiologists, we also are always looking to the future. We want to understand, is there a potential for this to change and increase the risk for that in the future? And the CDC actually uses a different system of risk assessment to look at future risk, and that's something that they evaluate as part of a pretty comprehensive list of criteria. And we do know that based off of the latest report that uses this system back in the summer, they did list the future risk of this influenza virus strain, the one that was identified in the dairy cattle, as potentially having a moderate risk for becoming a future pandemic. Now, again, we use these different classifications in these systems to determine how prepared should we be. So in this case, yes, right now the risk is low, but we are on alert in order to be able to activate the things that we need to activate, like good surveillance, good monitoring, so that we can collect the data necessary to make sure that if we need to implement measures to mitigate that future risk potential, that those are being done appropriately.
We mentioned California declaring a state of emergency because the virus has hit their dairy cattle. So the question is, could the virus end up in our milk?
Well, we do know that the virus does show up in the milk. So that's exactly what happens when the dairy cows are infected. It's actually impacting their mammary glands and actually showing up in milk. What that means for the milk supply in the United States is there's actually no risk to the milk supply that's pasteurized. So pasteurization is an effective way of eliminating the risk of the virus if it were to be in the milk. And so, thankfully, that has been shown and validated, and that's well known. So there's no issues with pasteurized milk, no issues with any kind of pasteurized dairy products. Where we have a little bit more concern is with what's known as raw milk. And so individuals that may consume raw milk that hasn't been boiled or pasteurized in any way, we now have evidence out of California, to be exact, that that's a risk of potentially transmitting the virus to people. But we also know that people feed raw milk to their animals, cats or other kinds of animals in their homes. And we also have evidence to show that raw milk that has not been boiled or pasteurized in any way can also cause infection when consumed by those animals. So the general takeaway here is that pasteurized milk is safe. Unpasteurized milk or untreated milk, we need to be very cautious about.
Are there other industries that could be at risk?
Well, the other industries that are impacted here is that the poultry industry definitely is impacted by this virus and has been impacted pretty substantially over the last couple of years. When this virus infects dairy cattle, it actually doesn't cause the dairy cattle to die at very high rates. So we call that a mortality rate or also a death rate. So it turns out that dairy cows can be infected, can actually recover, and actually can then resume their normal function. That's not the case for poultry. This virus is very lethal in poultry and actually is very lethal very quickly. So when the virus gets into a poultry flock, it can spread in very rapid ways and cause a lot of death in that flock. And so because of this, the way that we handle infections in poultry is a little bit different than what we do with the dairy cattle. And that ultimately results in the depopulation of the flock to try to contain the spread of the virus. So if the virus ends up in a poultry farm, whether it be a medium or a large size poultry farm, it typically means that the entire farm is going to be impacted and potentially may cause a loss of that flock through the depopulation approach.
Right now, the CDC says there have not been any confirmed cases of people in Florida getting the virus. Is there anything that makes Florida different from other states?
I wouldn't say that there's anything quite uniquely different, but there are some things that are worth noting. Florida exists on the East Coast, and there is a very well-known migratory bird pathway that runs down along the East Coast of the United States. Coming back to the name of the virus, it's called bird flu. And the reason it's called bird flu is because it originates in these migratory birds. And so birds can be infected by the virus. It doesn't actually cause lethal infection among most of those kinds of birds. And so they make really good vectors. They can transport the virus very well across great distances when they migrate. And so Florida is known as a part of this migratory bird pathway. And so we do ultimately end up with a lot more birds that can pass through and also settle into the state as they're maybe resting along the way. And this can create opportunities for those birds to mix with other animals that might be in our state, including poultry or other animals that are able to be infected by the virus. And so, we do see a higher number of cases of infection happening in all states that exist along these migratory bird pathways. And there's multiple ones in the U.S. Where we get a lot higher concentration of these wild migratory birds bringing the virus through.
Are there any other extra risk factors for Florida?
I wouldn't say, significant risk factors, but we do also have, wildlife in Florida. We have mammalian species. Um, the way that potentially the wildlife interact with those birds could potentially increase of the virus or the number of infections that might occur. But based off the data, we haven't seen Florida at a much higher rate than some of the other states that also exist along these migratory bird pathways. I also want to caution as well in terms of the data, there are some differences in data related to just the amount of reporting. And so Florida has a really strong system of investigation of these cases through the state agencies. And because of that, we do get quite a bit of information about, H5N1 bird flu infections in the state that is also related to the amount of investigation that takes place.
What would you say is the biggest threat with bird flu? What is there a worst case scenario?
Our biggest concern with this virus, like we have a concern for all novel influenza viruses, is the ability of this virus to do what we call reassort or recombine. This virus, when it infects an animal or a person or any susceptible organism, if that animal is also able to be infected by other kinds of influenza viruses, let's say human viruses or let's say pig viruses, those viruses that are infecting the same host, they can actually mix their genes. They can switch out their genes with each other. And what can happen then is it can create a new virus that humans have never, our immune systems are not used to. And when that happens and that virus is able to be transmitted to people, that's when we start to have pandemics. Again, I mentioned the 2009 pandemic. That's exactly what happened then. Is we had an avian influenza virus, a pig influenza virus, and we had a human influenza virus mixed together and create a new novel virus that was susceptible or was able to be transmitted to people. And that ultimately is what sparked the 2009 pandemic. So we want to watch this virus very closely. We want to understand if it's able to have human-to-human transmission, and we also want to monitor for this potential recombination so that we can be prepared and have the ability to understand what kind of risks exist, and hopefully have some mitigation or some prevention strategies in place to limit its ability to spread.
Listen, I know you don't like to make predictions, and I hate to ask you to look into a crystal ball, but what could we see over the next year related to bird flu?
Well, what we do know is we have data patterns. We've seen this virus now circulating in the United States over the last 2 years, and we do know that influenza virus, this one as well, does follow some seasonal patterns. We have seasonal patterns that exist with migratory birds, so we can actually have some understanding that it's likely we'll see higher levels of transmission taking place during times when those migratory birds are at a higher rate of movement. And we also know that certain places that have a higher concentration of susceptible animals that may be able to be infected by the virus may be at a greater risk. So we have to be very, proactive about understanding where those concentrated areas might be. For example, if you have a high level of poultry operations or you have a high level of dairy farms, we want to pay a closer attention to that. And so I don't anticipate the virus going away. We're going to have to continue to monitor its circulation. I'm hopeful that we'll be able to continue to collect the information necessary in order to be able to make good informed public health decisions about prevention. And primarily a big part of that is educating the public and letting them know what this virus is, how does it transmit it, what is the actual risk involved, so that people can also make good decisions about their own risk, but also be a part of informing and reporting if they see dead animals or dead birds, and be a part of our ability to actually track the virus.
Dr. Anderson, is there anything else you would like for people to know that we haven't covered about bird flu?
I think for the most part is to understanding what we've talked about today, what it is, and then again, coming back to what can you do as an individual to protect yourself. The biggest areas right now we know of exposure is people that are exposed to livestock or poultry. And so if you are keeping chickens, if you are keeping other livestock, and you are interacting with those animals, there are some very basic biosecurity measures you can take to protect yourself and your family, to protect your animals, including a lot of the times just more basic hygiene principles. And so that's a big that's a big public service announcement that we're trying to get out there, is that if you do know that you're in this category of a higher risk where you have contact with these animals, you should definitely be aware of what's going on with bird flu in your area, in your state. Be informed in those ways, but then also be informed and educated about some of the practices you can implement right now to mitigate your risk.
Dr. Anderson, this was very informative. Thank you so much for your time and your insight. We appreciate it.
Thank you so much. It was a pleasure.
And thank you guys for joining us. And remember, we always break news on clickorlando.com, and we will see you back here at News 6 at noon. Have a good day.